I think a lot of women are realizing how little we are actually taught about perimenopause and menopause until we are suddenly experiencing it ourselves. And the truth is, it's so much more than hot flashes. We're talking about sleep, mood, metabolism, brain fog, libido, and overall quality of life. So today we are having a real conversation about hormones, midlife health, and how women can better understand what's happening in their bodies during this transition. And there's no one better to have this conversation with than Dr. Gail Jackson. Dr. Gail Jackson is a board certified OB-GYN and a menopause specialist. She spent over 30 years in women's health and with more than 15 dedicated to hormone health balancing. Dr. Jackson believes midlife isn't a crisis, it's a glow up. Let's explore how she helps women feel absolutely fabulous. Let's start by understanding the basics, Dr. Jackson. Can you explain the difference between perimenopause and menopause, and when do women begin this transition?
Well, perimenopause and menopause are really all definitions. What we're really talking about the symptoms associated when your body is not producing enough hormones, endocrine hormones, specifically the ovaries producing estrogen and testosterone. So menopause is really a definition of the day that you've gone 1 year without a cycle. So perimenopause is the time before, usually starts between mid-40s till that day when you stop having a cycle. And then some women can continue, unfortunately, many women continue to have those symptoms long before. So when they talk about menopause, women are usually I like to clear that up. They're usually talking about the symptoms suggest that they're experiencing that are associated with that they're feeling because the body is no longer making estrogen and testosterone.
That's actually a really good definition because sometimes we get so confused. And your practice focuses on hormone optimization and balancing using bioidentical hormone therapy. What inspired you to specialize in this area?
I have 30 years practicing OB-GYN. And about in 2010, I had girlfriends, and patients who were a bit older than me who were absolutely miserable. And there was nothing there in the Western world, because I'm board certified in OB-GYN on staff at Cedars. There was nothing there that was safe and effective for these women who were miserable at the prime of their lives. They're feeling just most miserable, being with these symptoms associated with menopause, perimenopause, etc., such as hot flashes, night sweats, dry skin, dry vagina. I had women who were CEOs that didn't sleep all night, and they had a presentation. They're giving the presentation and they're dripping in sweat. And they said, I got to have help. So it became my personal focus and my calling then. And selfishly for me, when it was my turn, I wanted to have all the answers for myself when it was my turn. So I personally been using bioidentical hormone balancing in the form of pellets, which we offer here since 2010.
That's awesome. I also want to touch base on your motto, which you write in your book. Dr. Jackson says, or believes midlife isn't a crisis, it's a glow up. I really love your motto. And I want to talk about your book a bit. What inspired you to write it, and what are some of the key takeaways?
Well, everyone told me when they come here, they whatever, you got to write a book. You got to write a book, because not only are they getting information, but they want women everywhere. They want to be able to take this book and hand it to a friend and like read this. And this woman's board certified. She's qualified. She's credentialed. Read this and to get a better understanding of what's going on in your body. And just understanding is not a part of the Western medicine curriculum. So we transitioned and added regenerative functional medicine to our practice in 2010. So this is before it was big. We were the only ones out shaking our flyers like, ladies, you don't have to suffer. You don't have to suffer. This was also after the study in about 2001 or so that frightened women and frightened physicians and made them take them off all hormones. So they basically said, no, you can no longer take hormones. And what can I do? Walk, rest, get more sunshine, exercise more. Women were miserable. And many women didn't accept that no. They just accepted that no in Western medicine, and they read and they transitioned to functional regenerative medicine and started using plant-based compounds from credible authorities and credible practitioners to help them transition through this time. So I think the basically the book is talking about all the secrets. I'm the girlfriend tells all her secrets that a woman needs who's going through perimenopause, and beyond, because I am that woman.
That's awesome. I read your book. I really like how you make it storytelling, but with science. I love how you break down the hormonal part, I love how you break down the stories, especially some of your patients who have been there with you for years and you have given birth to their children and they're still with you on different stages of their life. Midlife is often portrayed negatively. Your motto is a glow up. How do you empower women to embrace this mindset?
I think women now, we have a new generation of women. It's not as hard for me to be the sole courier of the information because the women, it's mainstream now. Huge actresses who are credible, who women believe are speaking out on the big screens. And they're basically like, this is not good. I'm not going to accept feeling like this. Like Halle Berry saying she went to her doctor and because she had vaginal dryness and was diagnosed with vaginal herpes. And actually it was menopause related vaginal dryness. And so, because there's so much conversation now, and because the last month or so, the black box label is taken off of the estrogen, the pharmacists can't keep the patch in stock. The patch is available. How we like the pellet because the patch has to be changed twice a week, and also it kind of peels off. And also, it may fall off when you're having sweaty, hot sex.
You touched upon the difference between perimenopause and menopause earlier. Are there factors that influence when a woman begins this transition, such as lifestyle or genetics or family history?
No, we used to think maybe if you started your cycle earlier, you ended it earlier. If you started later, you ended later. But there's no rule. Your body follows no rules.
There's a lot of hype around bioidentical hormones. Could you explain what makes hormone bioidentical and how it differs from conventional hormone therapy?
Yes, bioidentical simply means the hormone that's introduced to your body, it reflects and is exactly the same as the hormone that your body's making. So there are a lot of options out there now. I don't think too many people use synthetics at all, or because they're patches, creams, pills, suppositories that are bioidentical. The pellets we use are plant-based. So not all are plant-based, but as long as they look like and mimic your body's own hormones, when your body receives it, it welcomes it like family. It's not like this foreign substance. It has, what is this? What do I need to do with this substance? It's familiar to the body and it just enters the body's streams, it enters the body's systems that are already in place to supplement them.
Many women experience vaginal dryness or pain. What treatments do you offer to improve sexual health during menopause?
Well, there are women who come to see us specifically and solely because of vaginal dryness, who are still trying to have sexual relationships. First of all, more sex helps. We start with just vaginal, you can do a vaginal vitamin E oil, and then there are lubricants. But there's also vaginal estrogens that you can place in the vagina. The one is prescription is kind of messy, but the compounding pharmacies do make suppositories and creams. So the vaginal estrogen can just permeate the tissue locally and bring her back to life. And the good thing is that estrogen that's introduced by way of the vagina is not absorbed throughout the system. So if there are any reasons why you can't take or choose not to take estrogen, you can use vaginal estrogen. So you can return to your comfortable and loving sex life.
Cognitive changes like brain fog can be unsettling. Do hormones help with memory, mood, or are there other strategies needed?
My God, yes. We have women who come in here because they can't sleep or they have brain fog. And testosterone is the main hormone deficiency that's associated with that, estrogen too. And now we have studies that share that having your hormones balanced with estrogen and testosterone do decrease the incidence of dementia and Alzheimer's. So there are long-term benefits of taking estrogen, testosterone, and progesterone when you need it for the hormones. And other than the dementia and Alzheimer's, it protects your bones, keeping them long and strong. I love my height. There's always something about yourself you love. Like you've got fabulous hair, but I love my height. So I keep my bones nice and strong with the balancing so I can maintain my height. That's the selfish of it, or the self-centered part. But also in nursing homes, 90% of the fatalities are secondary to a fracture due to a fall from women whose bones are not supported adequately.
That's such a good point. And I think there are so many myths around menopause. What are the most common misconceptions about menopause that you encountered?
Well, let's see. That there's a start and a stop to it. That I think the most common question people ask is how long this is going to last, which we don't know. Because we balance you, and then some people, I have patients that come every 2.5 months. I get mine every 2.5 months. There's some people who come twice a year. Some people come once or twice. I don't see them forever till they finally make it. So I think some of the myths are some of the things you have to live with. And you really don't have to live with some of the symptoms that we know are associated with menopause. And every day it's a new symptom that's coming through the Western medical journey. Oh my God, look, women who are taking hormones have way less heart disease. They have less heart attacks. They have less brain fog. They have less Alzheimer's and dementia. They have less broken bones. So every day it's like an aha moment in retrospectively for women who have continued to stay on hormones.
For women in their 30s or early 40s, what steps can they take now to prepare for a smoother transition?
Well, first of all, you get your labs, and there's no time limit to start or stop. So if you start experiencing symptoms, and women in their 30s to 40s, usually the most common thing they experience is difficulty sleeping. They laugh and say, okay, now the kids are finally sleeping all night. Why can't I sleep? So that's the most common. That one, and difficulty losing weight. They're working out the same, eating the same, but the weight won't move anywhere. So those are the two common symptoms I see in women in their 30s and 40s. So there's no time too early to start, and there's no time too late to start. So I think that's important, because some women say, I've been in, menopause, meaning the periods have stopped. They had the immediate relief from the hot flashes, etc. I finished that. I'm done with that. It's 10 years out, but now I'm so exhausted. I have brain fog. Can I take pellets? Can I get hormones now, or is it too late? It's never too late.
That's a good point. And a great relief. Many women feel dismissed when seeking help. What advice do you have for advocating for oneself with healthcare providers?
Well, I think, first of all, this has to be a physician's choice to learn more about hormone balancing. And it was my choice in 2010 because my patients were miserable, and selfishly for me when it was my turn. And I think healthcare providers should really be open with patients and say, if they're not aware of it, if when we say if you're not up on it, don't be down on it. Because if it's not in the Western Journal and you're not aware of it, it doesn't mean it's not factual in their opportunities. It's best to say, I don't know, I'd like to help you, but this is my limitation. But I'm sure there are providers out there who can help you, and this is where you can look.
Before we move into a fun rapid fire round, is there anything else you'd like to share about finding joy and confidence during perimenopause, menopause, especially for women who are probably confused?
Well, I think the joy comes with the balancing, and just really the reassuring that it's not in your head, you're not crazy. As I said, and it may be just one symptom. It's not, many women come in who are not miserable and 5, 6, 7, 8, 9, 10 symptoms. Sometimes it's one, but you don't have to suffer from that one symptom, because balancing will just help you and just increase your quality of life. So you don't have to settle now for in this very special prime of your life. You have a lot less responsibilities. This is really time for you to grow and glow. And you don't have to settle for anything less, and seek all the options will help you optimize your health and your well-being during this time.
That's awesome. I am a data scientist. I am someone who believes in tracking our symptoms, checking on our labs, and keeping track of what's happening, or even trying to understand why the symptoms come. So, based off of that, what are few symptoms you think women miss or misunderstand when going through either perimenopause or menopause?
I think muscle and joint aches. I think we're now, Western doctors are finally acknowledging that that's related to menopause. And the vague things about brain fog, anxiety, mood swings. A lot of women are not, they know about hot flashes and night sweats, but they're not familiar with some of the other milder symptoms that are specifically and more closely associated with testosterone deficiency, irritability, anxiety, difficulty sleeping, moodiness. You find that you snap off and be a little jerky with people when you're talking to people. You snap back a little more. Patience, and so I think women think that when you get older, there's something you have to accept when you really don't.
All right, are you ready for a rapid fire round?
Oh my goodness. Okay, we'll see. Go ahead.
In one word, how would you describe menopause?
Have to get rapid fire. One word. Varying symptoms. 2 words.
What's the one essential self-care habit for women over 40?
Weight training.
Coffee or tea to get through a busy clinic day?
Oh, I'm sorry, coffee.
Coffee?
I like both, but coffee.
Your favorite empowering mantra for midlife women?
I think you don't have to suffer through it. And I have the I have the answers for you. You just don't have to suffer.
What's the biggest myth about menopause that drives you crazy?
My doctor said I might get cancer or have a stroke. Heard that one just now.
No. Hot flashes. Do patients complain more about that during daytime or nighttime?
I think it equals, but I think it's equal, but I think about it more at night. Not the night flashes, not night sweats.
Thank you, Dr. Jackson, for sharing your wisdom and for reminding us that midlife can be fabulous. Thank you.